Okay, so this is a disclaimer. If I get emotional through this whole video, please don't watch it if you don't want to watch it. Okay, thanks. This is my second video. I will be talking about congenital heart defects today just because it is very near and dear to my heart. And not only that, but a lot of people don't know about congenital heart defects. On the other hand, I really want to appreciate if you are watching this. Thank you for watching this and taking the time out of your day. So I'm going to start off this video with giving the proper introduction of a congenital heart defect or disease. Defect and disease is a very interchangeable word. A lot of people will say defect just because it actually is a defect of the heart, and some people will say disease because even though it's a defect, the disease is with you forever. It never goes away. There's never a cure. There's always repairs in medicines and treatments, but you will always be with that particular disease. So congenital heart defects are presented at birth. That's why it's called congenital. It could do anything from the heart, the vessels, the arteries, the formation of the heart. Anything that you could possibly think of that can go wrong with the heart is considered a congenital heart defect. The facts that I am presenting today, majority of them are going to come from the American Heart Association website. I will link it in the description of this video. Feel free to check it out yourself. There's a lot of helpful information in there as far as facts and anything that you may need help with. Causes of heart defects that a lot of people don't understand. Majority of the causes, there is none. There's no unknown reason as to why it would happen. A lot of people say, oh, well, it's the genetics in your family. And it's not. Sometimes, though, it is a genetic syndrome. It could be a single gene, or it could be environmental exposure to the parents of the kid that is born with a congenital heart defect. A couple of facts that I would like to give: over 1.3 million Americans right now are living with a congenital heart defect. Even though they might have been repaired, they are still living with it. In the United States, about 40,000 children are born with a congenital heart defect, which leaves around 8 of every 1,000 babies that are born that will be born with a congenital heart defect. The problem with congenital heart defects is, as much as cancer and any other kind of diseases, anything that you can think of that has some sort of funding to it, congenital heart defects never have the proper amount of funding or the funding for the research that it needs. It's hard for researchers and scientists to find solutions for children, and even once they do find those solutions for children, adults such as myself, and there's plenty of other adults that are still living with congenital heart defects, do not have the proper research or the resources to help them have a happy and quality life. So, since I found a list of different common types of heart defects, I will list them off right now.
Aortic valve stenosis, atrial septal defect, coriation of the aorta, complete atrioventricular canal defect, detransposition of the great arteries, Esbion's anomaly, hypolastic left heart syndrome, I-transposition of the great arteries, patent vesicus idirosis, pulmonary atresia, pulmonary valve stenosis, single ventricle defects, tetralogy of Fallot, total anomalous pulmonary venous connection, tricuspid atrius, tricuspid atrosis, and ventral septal defect.
All of these, and including many more, children are affected with. Almost every 15 minutes, a baby is diagnosed with one of these conditions or others. It's important for people to realize, even though a person may look 100% perfect on the outside, they might not be perfect on the inside. To me, it is really, really, really a mental battle when someone doesn't realize that my insides are completely different from what I look like outside. It's almost one of those things you never know what someone is going through, so don't judge a book by its cover. It is very, very true for babies that are born with congenital heart defects. I actually know people in my family that have congenital heart defects and did not know that they had them until later on in their adult years. This is very, very normal. And then it's also normal to have congenital heart defects and to not have any kind of surgeries until you're later on in life, because quite frankly, the doctors can't operate on you anytime soon. A lot of people don't realize those that are battling with congenital heart defects and also the family around are very much affected in different ways. As a child growing up, I was always very limited on physical activity. Even though the doctor never wrote me off or anything, running, I don't know if anyone else has had this experience before, but we had to run a mile for our physical fitness test every year. And whenever I would run mine, I remember always having these very severe chest pains and very severe shortness of breath. Even though the PE teachers or any other kids, they were running perfectly fine. Me, on the other hand, I was pushing myself to the ultimate limit because I essentially physically could not do it, but I was still trying to do it. No matter how much I knew my body couldn't go. This is one of the many limitations that congenital heart defect patients have to deal with. It's not only physical, but it is mental. There's learning disabilities along with some disabilities that people may not see. So there is depression, anxiety. Please wait while my dogs finish barking.
Few minutes later.
Okay, I think they're done. Families that have to go through a kid with a congenital heart defect, or even an adult that is going through it, it's really important to know that a support system is very much necessary. It may seem like for the adult that you don't need that support system, but once you do have it and you go through that obstacle and you're going through it and you have those people near you, it's very, very relieving to have. I can't speak for the families that have to watch their babies go through this, but I can speak from the side of going to multiple doctor's visits and seeing those children. I remember it was probably 3, 4, maybe 5 years ago. I went in for one of my annual MRIs, and this was going to be one of the longest MRIs that I was going to do. And I remember it taking forever to go in the back and for them to call me back there. I'm like, okay, what's taking so long? My appointment was here. I was supposed to be in the MRI machine. I was supposed to, get in, get out. Little did I know they had a kid in there. Probably 3 or 4 year old, and the kid was in a bed, had a bandage around his head, and that is probably the only thing that I seen, because I had to look away immediately, because you don't realize how special you are until you see that. So for me, it's really important that I spread the awareness for those kids that can't speak for themselves, or the parents that can't find the words to say at the right moment, or for those that just don't have their kid anymore because they never got to make it out of the hospital. So with that being said, be kind, because the minute you're not kind to someone that is going through battles that you can't see is the minute that person realizes how not important you are to them. I don't mean to be mean whenever I say that, but people that go through medical trauma, as far as serious surgeries, serious predicaments in life, they will only keep the people around them that look out for them, for their well-being, their mental well-being, their physical well-being, and everything like that. Because if that person isn't around, as far as if they're a negative person, then they can do better off without you around. Wrap this up, it is really, really, really important for people to understand their risk, and also the importance of the awareness of congenital heart defects. It's not just the fact that we have minimal funding or minimal awareness to it. It's the fact that it's not important until it affects someone that you love and that you care for. I know a lot of people will say, but you're doing fine, you're doing wonderful. Despite the fine and the wonderful, it's a lifelong battle. And it's something that needs to be brought up. It's something that people need to know about. But it's also a blessing in disguise. Even though I might have been given the cards of truly hectic and utter craziness, you still have to give it your all. And so, to anyone that's... I'm gonna beat my dogs. To anyone that is going through with any kind of medical trauma or anything in their family, I wish you the best. I hope that everything works out in your favor. I hope there's no pain and there's nothing but peace and happiness. I hope that this video gets to the right people that need to see this. I love each and every one of y'all. I hope y'all have a blessed one, and I hope to see you soon.